Good morning, Matt here to give a brief introduction to a little acupressure set you can do from home. These are some of the first points I learned and I'm going to share them with you. First I'll teach you how I was kind of taught them, which is very general, and then I'll go over what they teach you in acupuncture school with a little bit more detail and going deeper into what they can do. Alright, so the first and foremost is called Hegu, and it's right at the valley of these two bones here, and you can press in there. A couple different locations in acupuncture school, they might say if you close your hand like this and the bump of the muscle, you can put the needle there. But as I was taught it was between the two bones here in the flesh. This is one of the most famous points because it's used a lot for headaches. And so you just press your thumb there and then press with the finger on the other side. See? I'm pinching like this. So I was told it's a great way to release negative energy or just to let go. Like mentally letting go, okay? So of course you can't just press it and then you're one and done. No, you have to massage it for a few minutes. You'll actually feel it open. It might soften up. It might feel stiff at first and it'll soften up some. And so you want to do this for a good few minutes until you feel a change. So Li4, here's some things about it. It's on the dorsum of the hand between the first and second metacarpal bones in the middle of the second metacarpal bone on the radial side. It's a wand source point of the large intestine meridian and a command point of the head and face. A wand source point means it's very tonifying. The indications are for diseases of the head and face and external pathogenic. That means if the weather, something from the outside like cold wind, hot wind, damp rain, summer heat, things like that. It's good for headache and body ache, dizziness, congestion, swelling and pain in the eye, nasosinusitis, nosebleeds, toothaches of the lower jaw, lockjaw, deafness, mumps, swelling of the face, facial paralysis, facial tics, swelling of the pharynx, inability to speak, aversion to cold, fever, febrile diseases, dysmenorrhea, amenorrhea, difficult labor, gastric pain, abdominal pain, constipation, diarrhea and dysentery, hemophilia, finger spasms, pain in the arm, infantile convulsion, manic psychosis and irritability, malignant sores, urticaria and scabies. Every type of pain and psychogenic tense. It's used in conjunction with liver 3. We'll go over that one next. And it's called the 4 gates when it's used in conjunction with that. So those strongly move the chi and blood in the body in order to remove stagnation and alleviate pain. So the functions are to expel the wind and release the exterior. Again, that's having to do with the weather, the changes in the weather that affect you. It kind of like gets on the surface of the skin and it releases it out. Helps tonify and strengthen, tonifies the chi and strengthens the immunity, stops pain and regulates the face and head area, and helps to induce labor in times where a woman's having a hard time giving birth. So it is contraindicated in pregnancy in the early stages of the pregnancy. Okay, so we'll go over liver 3. Liver 3 is kind of like the same thing. So in the hand we have this here. So now we just go to the foot, the same location but in the foot. We're going to go right at the top of the toe. Let's see. Here's my foot. About right here, right between the two, like the valley of the toe. It's liver 3. So I was told it helps with the blood circulation, helps with the liver, and the liver blood helps with depression. And so what they say in acupuncture school, it's located on the dorsum of the foot in the depression proximal to the first metatarsal space. And again, it's another wand source point, so it's very tonifying. So it's good for headaches, vertigo, redness, swelling, and pain in the eye, depression, pain in the hypochondrium, which is the side, abdominal distension and hiccup, weakness and numbness and pain of the lower extremities, difficulty in walking, irregular menstruation, hernia, epilepsy, and infantile convulsion. It regulates the liver qi, subdues the liver yang. The liver yang is in Oriental medicine, the liver is seen as an organ that spreads the qi out in all directions. But when we get stressed, it might go upwards. It's going to spread out nice and evenly. It's going to go upwards and it's going to give you a headache. And it helps calm the mind and it helps nourish the liver yin. And what liver yin is more moisture. So think of yin as like blood and fluids. Okay? The next one I want to talk about is Gallbladder 20. It's in the back of the head, right here. It's right on the top of the trapezius muscle. And when the patient is face down, I use that a lot to calm them down. I was taught that it's a very calming point. But on the technical side, what it's good for, the Chinese name is called Feng Chi, the wind pool. Located on the nape below the occiput at the level due 16 in the depression between the upper portion of the sternocleidomastoid and the trapezius. It's a crossing point of the gallbladder meridian and the yang wei vessel, and it's used for common cold, nasal congestion, headache, redness, swelling, and pain of the eye, rhinorrhea or epistasis, which is nosebleed, rigidity and pain of the neck, limitation of the shoulder, dizziness, vertigo, hemophilia, and epilepsy. It helps dispel the exterior and interior wind, clears heat, benefits the eyes, nose, and ears, subdues liver yang, and activates the meridian and relieves pain. Another super important one I was taught is here at the elbow. So see this line here? So right below that, right between the two bones is this point. So this line is actually pointing towards the point. Sometimes when you get acupuncture from me, I might bend your arm so I can find it better. So it's just the depression in there. The books might say it's located a little bit differently, but I still use just the way I was taught. So this is large intestine 11. The Chinese name is Kuchi, meaning the pool at the creek. It's within the elbow. When the elbow is flexed, the point is on the lateral end of the transverse cubital crease at the midpoint between lung 5 and the lateral epicondyle of the humerus. It's a Hesi point, so it means it's very strong to affect the organ of the large intestine. So it's a Hesi point of the large intestine. So the indications, so when I was first taught it, it was to help the blood circulation, help to move blood and cooling the blood. So the books will say, it's for all febrile diseases. So anytime you have any kind of fever, sore throat, malaria, hemophilia is good for that. Pain and motor impairment of the shoulder, swelling and pain in the knee. It's for headache, dizziness, redness, swelling and pain in the eye, irregular menstruation. It's good for abdominal pain, vomiting, diarrhea, depressive psychosis and madness. So the function is, again, to clear heat, to cool the blood, resolve dampness, expels exterior wind, regulates chi and blood, activates the meridian, and it helps relieve itching. So anytime there's some kind of skin issue, that's a really good go-to point. Another one that's super important is called stomach 36, Zusanli. It's right here. If you take your fingers, about 4 fingers, this is called 3 chun. It's like 3 inches in Chinese acupuncture. So right at here's my kneecap, this little thing here. I'll go 3 chun. Here's the bone. It's just right off the bone. Here's my tibia. So it's right here. Okay? You can massage it with like all your fingers like that. Of course, you'll want to massage it for a little bit longer than just pressing it. Or you can press it really hard and kind of hold it. I was told at first this is your chi point. This is the most important chi tonification point in the body. And so this one was for blood. This was kind of like the yin, and then this was the yang. And they both have one thing in common. They're both Hosi points, which are usually around the elbow or knee, and they both Yang Ming. Yang Ming means like big, bright chi. So they're both part of the same meridian system, but this one's in the arm and then this one's in the leg. And again, they're Hosi points. So this is Hosi point of the large intestine. This is Hosi point of the stomach. So without further ado, let's talk about what you would learn in acupuncture school. So it's on the anterior aspect of the lower leg, 3 chun below stomach 35, which is right below the kneecap. 1 finger's breadth, 1 finger in, from the anterior crest of the tibia. It's a Hosi point of the stomach, a command point of the abdomen, so it's a go-to point. Anytime you have something with the abdomen going on, you can go to that point. And it's also the point of the sea of water and grain, so that has to do with food and digestion. So the indications are gastric pain, vomiting, dysphagia, which is like hard to swallow, abdominal distension, diarrhea, indigestion, dysentery, constipation, abdominal pain, emaciation due to general deficiency, palpation, shortness of breath, poor appetite, lassitude, dizziness and insomnia. It's good for cough and asthma, pain in the knee joint, hemophilia, beriberi and edema. It's also good for depressive psychosis and madness. So the main functions are to tonify the chi and blood, harmonize and strengthen the spleen and stomach, strengthen the body, and the wei chi. The wei chi is kind of like your defensive chi. It's seen as like chi that's outside the channels and kind of almost like outside the body, kind of like almost like an aura. It helps raise the yang. So if you get in like a really deep yin state, it can help balance you out. So yang is kind of, you can think of it like some energy. So if you're in a yin state, you want to completely shut down, it can help revive you. It calms the shin. The shin is the mind, helps calm the mind, and it activates the meridian and stops pain. Okay, so that's it with some really common and important points I like to talk about in Chinese medicine, and hope you can try to put it into practice and try to use it sometimes if you're not feeling well. And you know, this is a global pandemic we're going through, but some of these points can help you in times of need. But just knowing a little bit can go a long way. So you have a great day, and we hope to see you at the clinic soon. Take care. Have a great day. Bye.